Welcome back to the Marketing Muscle Up podcast show. I'm your host, Richard Turngi, and today in the studio I've got Ken Griffin, the newly appointed CEO of AUSactive. Welcome to the show.
Thank you. It's great to be here, and it's great to be talking to you and your audience. It's a great sector to be in, and I'm so proud to be a part of it now.
You've been on the road last couple of days. You've been touring. I've seen you like a few times over the last 2 weeks. You've been everywhere. My first question is, let's just go straight, before we know who you are, let's go straight to the most interesting thing that you've found in this sector in the last 7-8 weeks since you've been here.
Well, this sector is always changing. So I've worked in 7 sectors previously, pharmaceuticals, healthcare, logistics, alcohol, you name it. There's one thing that's been different about this sector to all the others, and that is the others always go, Ken, you're new here. We're not like where you've just come from.
Okay.
Whereas this sector has been great. They're going, you're here. Hey, welcome. Like, people have been so generous with their time and their understanding and their knowledge. And I love that about this sector. It's an arms wide open sector. They've really embraced me when I've been traveling around, and it's been great to really understand what it takes to be successful in this sector.
Yeah, great. Where have you come from? Tell us the little backstory, how you got the job at AUSactive CEO. You got some big boots to fill.
Yeah. Well, Barry certainly set a really strong standard, and he'll have a legacy for decades to come, I think, in this industry. My background, I'm a country boy originally, so I'm pretty practical. I have come out of the healthcare sector for the last 20 years. That's kind of been where I've been. And most recently, I was working for a nursing organisation that represented 100,000 nurses outside hospitals. So general practice nurses, school nurses, aged care nurses, and I promised them that if they weren't at the table when the government was making regulation and changing the health system, that I would drag a seat to the table so that their voice could be heard.
Yeah.
And I spent 7 years doing that, and I'm really proud of some of the changes we made then, because we actually put those 100,000 nurses in the centre of health reform in Australia. So if you heard of the Strengthening Medicare Task Force, we're on there. We've sort of really created a lot of change in health because of how we went about that. But the dirty little secret I have is that a couple of years into that role, the math wasn't mathing. The primary healthcare sector, so where all the nurses that I was working with, they talk about prevention and they want to stop people getting into hospital and getting sicker. But when they talk about prevention, they're talking about a model where you have to be diagnosed before the health system kicks in behind you to give you support. And if you start looking at what it takes to be diagnosed, the diagnosis in the health system around things like chronic disease in particular, which is one of the biggest challenges we have as a country, involves the system acknowledging that there'll be some permanent damage that has already occurred to you. And then they'll swing in behind you. Now that's fine. There'll be some people where the ball goes through to the keeper and you're just going to have to pick them where you find them and actually give support to them. But for me, a couple of years in, I was just thinking, that's not really prevention. I don't accept that people should be damaged before the health system kicks in behind them. So I realised that I was going to have to go upstream and start doing what the primary healthcare system is doing for the hospital system, and that is go up before they hit the primary healthcare system.
You were frustrated with what was happening? Is that why you're going upstream?
That's right. We can't accept that. It's such a big issue, chronic disease and even mental health. If we can get to people before that, then we're actually able to save the health system, save people a lot of grief and poor health in their lives. A big believer in a long life and a quick death. We shouldn't be living unhealthily to the end of life. So let's catch people early. And that means that I can't accept that we should wait until there's permanent damage before we prevent. And so there's a role for where I've come from. I'm passionate about health, but all the people in health who have been calling me just to say over the last 2 months since I've had this job, what's it like to be out of health? Yeah. My question to them is, why do you think I've left health? I haven't left at all. We're just going upstream and we're going to do great things in this sector to really keep Australia healthy, which is what everyone in this sector has always really wanted to do.
Are you a minority in the medical sector where they're saying, hey, Ken, what are you doing? You've gone upstream, or are you in the health business still? Is this a minority from that side, the sector that you've been into, the health, or I should say the medical and the nursing sector?
Well, it's not really a minority, but I take your point, because every medical or health conference I've been to for the last 20 years ends up in exactly the same place, which is we need to think about social determinants of health, which is basically a fancy way of making sure social policy and all the factors that shape our society actually support good health outcomes. Now, every single health conference, bar none, has always ended up at that place. Our sector, as far as exercise and active health, in all its different formats, plays a really significant role in that. Like 1 in 2 people who get intentional about how they want to get active or lose weight choose a gym.
Yep.
What we need to do is actually get that beyond that, because 1 in 2 sounds really good, but there are people who walk past gyms every day
Yes.
of the different sorts, and they don't even think that is a place for them. They're the people that we should be fighting for. So when I think social determinants, I think there. So every health professional in the country goes, we need to treat people holistically. We need to target those social determinants for health. We need to engage people. We need to engage groups of people, because we know that we've got groups of people that changes behaviours. Well, guess what? Our sector does that.
Yeah.
This sector is so great, but it's sitting in the blind spot of the system, but it's actually doing everything that every health professional deep down inside them wants to do.
Totally.
But the health system doesn't pay them to do. And if I'm honest, they don't have the skills for it. They're not trained to do things in groups. They're not trained to do that stuff before the diagnosis.
Well, the big question, I'm super passionate. I'm one of those that started off the industry 17, got some studios, got some gyms, wrote a best-selling book, all about kids' health. And then everybody, I think, in this, I say everything in health and fitness, the one that owns the gyms or the studios, they're passionate, they've been there for years. They see it, we see it, but what's the 1 or 2 things that we need to do so everybody else sees it? Because it doesn't seem like obesity is on the dramatic reduction down. Is anything changing for the work we've already done?
Well, I think this is the interesting thing, and it all comes down to trust. When you sit in the blind spot of policymakers when they're thinking about health, you're not even, like, for nurses, I had to get them to the table, but they knew who nurses were.
Right.
Like any health administrator at the moment, our sector doesn't fit in a box that they can comprehend.
Yes.
But when we start talking to them, they kind of go, of course. It shouldn't be new knowledge for a member of the Department of Health or an employee in the Department of Health to go, exercise done in a specific way is actually just as effective or more effective than first-line depression and anxiety therapy. It shouldn't be new knowledge for a member of the Department of Health that exercise done in the right way can actually reverse type 2 diabetes. It shouldn't be new knowledge for someone to realise that weight-bearing exercise actually can change the trajectory of someone with osteoporosis. It shouldn't be new information that heart health is dramatically improved if you get someone exercising more regularly. In their minds, they go, but doctors recommend it. But we've all been to a doctor and they said, and sort of eat less and exercise more. And we know that when health information is conveyed to a patient, and they've done studies on this, they'll actually grab the patient and the doctor outside a consultation and go, okay, what just happened? And the doctor will go, I told them they needed to sort of exercise and eat less. I told them that they needed to cut down on the smoking, and I told them like the drinking probably isn't so good. And the patient's going, my life's over. and they're not motivated. They're not thinking this is an opportunity. They're going, someone just told me that I'm doing the wrong thing. This is the stuff where the health system is still didactic in many ways. In fact, the health system is trying to improve itself, but it's hard. It takes 10 years to train a doctor. So guess what? If you start changing the system now, you're not going to see anything for 10 years. So we motivate people every day in our sector. We're not just sitting there going, maybe get on the weights a bit. That's what actually happens in health every day. They're basically saying about health, get on the weights a bit and then sort of stepping back. We actually go over there. We actually look at their technique. We're actually making sure that they do this well and that they don't hurt themselves along the way. And we don't say come back in a year's time for a checkup. We're on the journey with them. We motivate people. We actually know what it takes to get someone engaged in all that. We know that when you're a gym owner, the most frustrating people are the ones who kind of signed up but they haven't been in for ages, because as much as someone outside the sector goes, well, that's just money for jam, we're sitting there going, no, we want them in here. We want them getting the benefit, and we want that for them. But we also know that they're unlikely to actually come back in again or renew a membership if we don't actually show them that benefit. So unlike the health system, which is talking to and sometimes at people, we're actually actively seeking to engage. That's what the whole business model is.
Yeah. You understand, hopefully 7 weeks into the job, I guess, you have a massive understanding. It sounds like you've talked to a lot of different stakeholders, small businesses, large businesses, you've been to a lot of events. What's the summary that we need to do as an industry to ensure that, by the sounds of it, the healthcare are recommending it? Because that's a strategy you're saying. So that's the fastest way that we can fill our gyms. Is that what I'm hearing?
Yeah. And we need to start backwards. So if that's a goal for growth, and let's be really clear, I'm going to talk in a real marketing language because that's the language I know.
I love it. It was the Marketing Muscle podcast, Jason. We want to know how to market our facilities.
Right. So when you think about how you grow a sector, there are several things that I think of. And the first one is, where do you get the growth to get people coming through? And you go, that's fine, because that's footfall, that's trial, that's actually people coming in and you're converting them into customers. What we know though in Australia is that 1 in 2 people getting intentional. I'm not satisfied with that. I don't think that we should be satisfied with that. I think we should be chasing more. And what we know is that we have facilities that meet very high standards. Like everyone knows who's set up a new gym, just what it takes to, you're kind of contorting yourself through different regulations of all types. And then you've got the mandatory education to actually make sure you can resuscitate people if the worst happens and all that kind of thing too. We do all that, but the public doesn't see this. When we think about how we grow our sector, it's actually not about competing with each other so much as growing the market. And when you grow the market, you've got to look at different ways to do that. And we've got one of the most saturated markets in the world. So we can't keep doing just what we've been doing.
The same.
Yeah.
I think everybody can agree with that.
So there's a growth strategy, right? So when I come from a health background, I see things through a certain lens. And I'm going to start from one of the real pillars we need to have, and that is trust. There are some people who have the trope in their minds that gyms are about meatheads, like lifting weights. So they don't think they'd want to cross them in a dark alley at night, right? But what we know is that our sector is so much better than that. It's vibrant. It's got a lot of regulation in it. We need to establish that trust, and we need to make sure no one's in any illusions as to how hard we work as a sector to actually not just be compliant, but go beyond that. And I make an example, GLP-1s. No one owns a gym at the moment, and no one's an exercise professional without knowing what GLP-1s are doing to people, right? Now, what I can tell you is most doctors don't know about weight-bearing exercise and why that has to be really strong, not just a recommendation, but an urging of a patient who's just got a GLP-1 script to actually get on a first name basis with a PT or be working at a gym with a gym program where you've disclosed that you're on a GLP-1. So those weight loss drugs actually have devastating impacts if you don't take care of your muscle mass. And that's without going to the osteoporosis and osteopenia side of things. But we own our space and we need to actually build that trust because of that. And we need to get that out there so that when we start talking about how we want to be involved more and more in solving the health troubles of Australia in order to grow our market and to genuinely help Australia, because it needs all the help it can get when it comes to chronic disease, we need to actually be building up that trust. One of the things that if we are going to link ourselves formally to health, which I think is really possible, we're going to have a way of reconciling the gap between the medical model where they have accreditation and regulation and registered professions. And if you're a registered profession, it actually means that it's illegal. Most people wouldn't know it. It's illegal to call yourself a nurse if you're not qualified to be a nurse. You can be put in jail for that.
Wow.
That's a registered and regulated profession just there. We're not in that. Anyone could essentially say they're an exercise professional and they could be doing damage out there. You see it with a lot of online influencers. Could be causing a lot of problems for people out there. So I think there's an element of AUSactive is really responding to this. You can be registered as a member, but you can also be accredited. So it's a new tier that we've got in there. And that's recognizing that for some people, they might be passing through our sector. They don't need to go to the full extent. They need to be safe, of course, but they might not need to go to the full extent of what a lot of the accredited members are. But those accredited members are going to be the ones who are actually likely to be picked up on by the health system to say, we're going to refer people with chronic disease, mental health issues, the aging population to you because we know that you can safely and we can confidently refer to you so that you can safely run them through a course that is going to improve their health and do that genuine prevention we're talking about. Now, for those who want to spot the flaw in my logic there, it is, hey, we're actually relying on the system that actually has to diagnose someone first before they send people in. Now, that's the first step, though, because then we ultimately want to work backwards from there. So let's do some maths. 5.5 million care plans are written by GPs every year. 3 million of them are for mental health issues. 2.5 of them are for chronic disease issues. These are people who don't get referred into our sector.
That's like 25% of the kind of country.
Population, right? And these are people who are from all walks of life. They have issues that our sector is more than capable of helping with. And what I'd ultimately see is, hey, what if instead of referring a teenager with anxiety or depression who's not really coming out of their room, instead of referring them to a psychologist, and my wife's a psychologist, so I'll declare an interest here, but her waiting list is 9 months, right? Now, she's one of the best in the field, child and adolescent psychologist. Instead of referring to a psychologist with a 9 months waiting list and saying that's a care plan, which it isn't, this is what's more frustrating than actually having the issue. It's actually being told you can get help on the government now, but you can't access it for 9 months' time. What are you meant to do in that time? What if we could actually either in conjunction with that referral or instead of that referral, refer that person to an accredited exercise professional who can run, say, a 10-week course that's evidence-based, that actually brings them together in a group and actually takes them through a evidence-based program that over 10 weeks can actually change habits, but also link them up with other kids going through the same thing with this accredited professional who then refers them back into the person who referred to them, right? The great thing about the referral back is currently those 5.5 million care plans, only 20% of them are reviewed. Wow. So they're not really plans if you don't look at them again. So we can actually solve a problem for the government where people come back into the system and they get baselined at both ends of those journeys, so we can also show the benefit of what we brought to that person's health.
That's quite phenomenal, because you're essentially saying, well, it's the clientele, the demand is there.
Yeah. It's
just plugging into that particular referral network.
Yeah, that's right, which already exists. That's a great thing. We've already got a register of accredited professionals. We already have a referral system in place. If I'm honest, one of the hardest things here will be getting that trust so that we can go, hey, we're not going to call them patients at the point that they hit our gyms.
Yeah.
We're not going to call them what the medical profession does it, because if we're not going to ever pretend to be health professionals, because we don't need to.
Yeah.
We know what we do.
Yeah.
We're not trying to be a doctor. We're not trying to be a nurse or an allied health professional. We know what we bring to the table and we own our scope of practice. We've got a defined scope of practice. We're actually just going to apply it effectively on a systematic and a population level. Here's the secret sauce in all of that. About 35,000 exercise professionals in Australia. One of the big drawbacks to the health system was it was designed 60 years ago for one-on-one. It doesn't fund a GP or a nurse or an allied health professional to do anything but one-on-one interventions.
Yes.
So that's for a number of reasons. People aren't going to disclose certain private things about themselves unless you are one-on-one. But it also means that their toolkit is actually missing all the group-based stuff. And at the heart of chronic disease is this lack of accountability and the shame that comes with, okay, I'm going to keep doing this thing until I've reached my goals. And that sense that I can't talk to anyone about it because I'm ashamed of being overweight, or actually it's my fault, I ate my way to type 2 diabetes, and it's not their fault. That's just society. Yeah. That's the problems of the modern world. But this is the stuff that actually stops medical interventions that are one-on-one and behind a closed door from being really effective, because it's not just a physical issue. It's a mindset issue. And we know that when you do things together as a group, you're more likely to stick to it. We know when you've got similar goals and you've found your people, you're more likely to actually keep up with that even after the intervention is gone. Now, when I start thinking about that, people with chronic disease, and it's 47% of the country that has one or more chronic diseases, so think of the market size. They also are the ones who tend to be absent from the workforce. They tend to be people who are absenting themselves from school. They tend to be people who have more sick days and all that kind of thing. When I think about the cost of the health system, we know for osteoporosis, CVD, type 2 diabetes, overweight and obesity, and one of the others that I mentioned, just forgot it, sorry, it'll come to me, $10.7 billion direct cost to the health system every year.
10.7 billion.
That's B with a, billion with a B, right?
Yep.
Those five are forecast to get to 53 billion by 2050. The need when the health system is under strain and has workforce shortages, and we could bring 35,000 people who get this, and this is the secret sauce bit. We don't have to see people one-on-one because there's nothing happening in our sessions that need to be behind a closed door. Okay. So our 35,000 people can have this amplified impact because we don't have to go one-on-one to do this. The system is groaning and actually unable to actually cope with one-to-one, which is what it was designed to do 60 years ago. We can have a multiplier effect, and I love that in marketing, but this is on health as well. You can have a multiplier effect because one exercise professional who's accredited, who's getting a referral, could be seeing 12 to 20 people in the same group multiple times a week. Now, from a business owner perspective, and I own a business, not in this sector, but I actually own an allied health clinic with my wife and a partner in Melbourne, so I get business. The great thing about that is because these people are outside the outside the system and not going to work as much and all that because their conditions are stopping them from doing that, we can actually be seeing these people when we have spare space and spare time. So using that latent capacity in our sites that we all pay a fortune for, we can be using the latent capacity in those sites, and PTs and exercise professionals can be using those times that traditionally aren't the busy times. So we're actually, and I'll use a term that I learned when I worked for Linfox, we're sweating the asset, right? We're actually going to get most out of those sunk costs while actually having a dramatic effect on the health of the country.
If that's the case, and it seems like it's an obvious bridge, what do we need to do to prepare for that? Like a studio owner, they're doing the best they can with the marketing. They're promoting, they're advertising, they're locally based, they've got signs out the front. Do we fundamentally need to change the way that we market or we brand or we position to attract that, 5 million or that 25% that you're talking about? How do we make sure that we're the right provider for those?
Well, I think it's really interesting. So if you think there's 5.5 million Australians out there, 20th of the population, or one in five is sitting there. No one talks about getting a care plan, right? No one talks about this. There's that kind of intrinsic, I've failed in some way. No one wants to talk about needing help. But it would be interesting to see how much uptake we would have if, even without the government coming on board, we're actually to say, if you're on a care plan, talk to us about how we can help you. If someone says, do you have a care plan? And it's not judging, we can help you. You think about everything that is on a care plan from a chronic disease point of view. So just go CVD, go type 2 diabetes, go overweight and obesity, right?
Yep.
We already get those people coming through. They'll already disclose it on the form when they come on in. So actually the idea of saying, hey, you're not just here to get fit because your doctor said exercise a bit more. We can actually tailor things that are specific to that if you've actually got a goal right now. And actually thinking about that, because we've already got the mindset around that. There's already so many great evidence-based programs that are being run in the sector, but also evidence-based articles that show actually this intervention run in this way. It's all freely available. It's just not what our sector is used to looking at, which is where health professionals who have been idealistic have gone, hey, there's this amazing super drug and it's called exercise. And actually we just realised that we should study this. And there's so much of that there. And it just isn't being implemented because the health system isn't geared up to do that stuff.
But I like the concept of just advertising for the simple thing that we can do is really just reaching out and advertising for that.
Well, and that's it. So, I mean, marketing 101, right? Are you selling the feature or the benefit? And, I'm a Frankston boy originally, sort of that's where I spent my teenage years. And there was a dentist who made a killing not literally, but he's in front of his surgery, he had this amazing billboard which said, "We cater for cowards." and literally he was one of the first people who did sleep dentistry. So put you to sleep and then does all the work on your teeth. So you're not worrying about drill sounds and all that kind of thing. And classic case, he sort of worked out, okay, what do people hate about this? What do people hate about this? And let's look at this. And it was, hey, you don't like pain, but he was speaking to people about it. I've broken my 2 front teeth. I actually fall asleep in the dentist chair. I don't need anaesthetic to do that. I'm comfortable there now. I was not the target for his thing, and I'm the minority of the population. But if we started talking, knowing that there's 5.5 million people out there, actually it'd be interesting to make that accessible to them, right? Because there is that shame when you've got a chronic disease. There is that sense of fallibility. My father-in-law had a heart attack and so he felt frail even though he wasn't anymore because he didn't trust his body anymore. That's the kind of thing we can give back to people. Yeah,
really interesting. I want to change the angle a little bit here because what I see here in the fitness industry at the moment, we are spending a lot of money, and we had this conversation before, we're spending a lot of money in designing amazing, beautiful spaces. And I can tell you every single passionate fitness business owner, they will ensure that they have new equipment over profits any day of the week. Yeah. Are we spending the dollars in the wrong place? Are we overblowing here when we possibly don't need to? Is that what you're saying?
We spend, I think, about $500 million a year on fit outs. I make the example of restaurants. If you read that a new fancy restaurant has opened in your town or city, suddenly you're hearing about the decor and it's like this amazing fit out, and you're hearing about the chef and you're hearing about the maitre d' and all that kind of thing. We open that many new gyms of all different kinds, and people are chasing the trends, right? That's the sector is very dynamic in that respect. But we don't have writers in every paper who just do restaurant reviews. Like, there's no one's writing about gym openings, even though we spend more. Like, we spend more on some of the big gym openings as far as their fit outs than any restaurant's investors would ever allow them to, right? We don't get kudos for that. And when you think about the fit outs of our gyms, it's not just tech and style and all that. It's also the fact that it is accessible. You can't build a gym now without actually having disability access, but we don't get any credit for that. But we're paying for amazing looking places that make you feel good as you come through, right? We don't get credit for that kind of thing. And there's this real double standard around the gym sector when you think about the scale of it. No one's out there talking about the challenge in the gym sector, and in the same way that people talk about hospitality is bleeding. Hospitality is like, we get on and do it. And we don't sit there thinking we're entitled to anything. We're not a sector that generally gets handouts compared to others. No one's coming from Victoria. There was for 3 months. Well, every 3 months for about 2 years, we're getting like $200 to go and spend at restaurants.
That's right.
There's a voucher program in Victoria, but it's means tested for the gyms, and then we have to jump through hoops. But literally, the government gave us cash to spend in restaurants. We're not a sector that gets this kind of thing, and it's when you think about 5 million people in Australia go to a gym every year. They're using our sector, right? This is big, and when you think about those who are using a PT, there's what it's like when you've got someone who. They're an advocate for you. Like they'll talk about you. Like, Richard, you changed my life, and you need to go and see Richard because, like, literally insert any issue someone has out. You need to go and see Richard. They're not confining you to being some kind of gym junkie. They're basically saying you get them, you get the issue, you can help.
That's why referrals are always the best source of marketing.
Yeah, that's
our clients are seeing us, multiple times a week. It's not just a restaurant. They may go 1 or 2 times in a month. They're seeing us multiple times a week. So it's a very personal relationship, and that third place that they actually be at.
Yeah, that's right.
So what if you take all that? What do we focus on in the next 12 months? We're going into 2026. What's the focus for a studio owner, a gym owner, to start nibbling at that 25% that's got the care plans? Is that the focus that we should have?
I think it's one of the things that'll be an interesting way, because if you're a small gym owner, or you're a gym owner who's, you've been doing this for decades, you've seen all the trends go through. You've seen like a whole heap of waves come through your sector that has fundamentally changed how you do things. Like, no one running a gym today is doing what they did 20, 30 years ago, right? The game changes.
It's like marketing, where we're changing different apps every day of the week.
Yeah, that's right.
And you can be consistent, right?
And like, when you think about the fundamentals of marketing, it's really about meeting people where they're at, and when they're most open to a message, and when they're most likely to act on the message that you've got to give. I actually think one of the biggest marketing misses that happens in a gym is the form that everyone signs early on. Like, when was the last time anyone really looked at
the pre-exercise form?
The pre-exercise form, right? When was the last time people really looked at that?
They're speeding through that thing.
Yeah, and I mean really looked at it, right? Because, I'm a big believer in asking the right questions. And there's a fundamental difference to someone walking into your gym and you going, "Hi," to which they'll always respond, "Hi." It's mirroring behaviour. Whereas, like, "How are you?" It's opening the conversation. It's expressing care. It's not just acknowledging you walking through. And those pre-exercise forms, like, when you think about the questions you could be asking there, because no one really doubts why they actually respond to there. Like, people are very compliant when they've decided they're actually joining.
They do fill those things in, don't they?
Yeah, that's right. They really do. Like, people, like, and in all honesty, there should be lots of questions about, where do you store this data? All the data and privacy stuff. It's rare that you tend to get that kind of thing, right? So if you think about the kinds of things that could be asked, are you on a care plan? Have you been on a care plan? Can we help you with that? If yes, it's the kind of thing where you can open up a conversation where you're doing 2 things with that. One, you're expressing something that they probably haven't expected. So it's not, because everyone, when they're asked to put down the diseases or, sort of health issues that they've had, have you ever had surgery, all that kind of thing, they're not thinking that you're necessarily going to care too much about that. They're probably thinking more about, okay, so they won't give me certain exercises, I get that, and they're probably thinking that you're thinking about insurance, for you more than anything. And, okay, so I've had these things, and you want to know that because you don't want to get in trouble, which is fair enough. But it's actually, have you ever been on a care plan? Or have you actually got any health goals? That kind of thing actually expands their understanding of what you're interested in. They're not expecting you to be a huge expert, but they're suddenly wondering if you are. And if you actually have a response to, well, look, actually we know, you get your heart rate above 160 BPM. It's one of the most effective things that you can do for depression. 160 BPM, we can't get people to there. You might have to build them up to it if they haven't done any regular exercise, but this is fairly common knowledge in our sector, but it's not something that your average person knows. That's right.
In the fitness sector as well.
Oh yeah, I mean, you get someone on a rowing machine, it's relatively low impact exercise to actually get someone up to that heart rate. They feel good, it actually is that high that all the runners are trying to get, sort of get that, sort of dopamine hit, but they don't always get to it. Yeah. So it's actually low impact. I feel amazing. Wow, I really got that heart rate up. It just really went up high. Actually do that for 10 minutes and guess what? You do that a couple of times a week, you're already beating most antidepressants.
It's almost like you could go to the gym and you could select what you want today to beat. You hit the button and I'm a little bit depressed today, I want to hit that, what should I do? I want to lower my blood pressure, what should I do? It's essentially marketing your product, the problem or the condition they have at that moment.
Well, and what's important to them right now? Because I remember doing my first pre-exercise questionnaire as a 16-year-old. What do you want to achieve here? Basically, I was going, girls, I want to get a girl. I want to be ripped.
Girls,
what did I say? I really like to build up my stamina. Are you asking the right questions to work out why someone's really here so that you can actually meet that need? And then you're meeting them where they're at and you're opening up a conversation which is got the potential for the classic marketing surprise and delight, right?
Yeah.
Actually, I didn't expect this. Like, I'm paying this much a week. I'm paying $20, $30 a week. I didn't expect you to care about that. I didn't expect you to know how to help me with that.
Yeah, well.
I didn't expect you to impart knowledge that I will kind of pocket away and go, okay, that's possible here. I came here just to, kind of just get out of the house because I'm a 21-year-old still living at home and it's kind of cramping my style and I do want a girlfriend or want a boyfriend. Yeah. Actually, you're helping with my health thing that actually I don't want to go to a doctor. I don't even think I can get in that easily if I do. I'm not sure if I want to disclose something to my family doctor who my parents also see. Will they tell them? I don't know. Yeah. Could someone in the surgery who I went to school with actually see that information? I might feel embarrassed about that. This is the kind of very human element of actually coming there where actually seeking to understand a bit more and reviewing those questions might be a really good way into some of those discussions where you're retaining people, but they're actually got that surprise and delight, that classic marketing thing.
And you've been on the road talking to some key stakeholders, some trainers, PT, studio owners, gym owners, event organisers, and what you're sort of saying there is quite fascinating. I'm really interested in that because to me, it's like, what's the angle? But there is an element where when do we have to stop what we've been doing? The $0 free joining fee, the lose weight over summer kind of promotions, right? We teach to our ninjas and our clients, market the outcome, but the larger organisations, right? When they're running campaigns and marketing campaigns, that's what they're doing at the moment. If the competitors are doing it, they're doing it. So how do we stop that? How do we just go, hey, I'm going to try something out different, but not be afraid to derail our plan?
There's this big thing that's happening in health right now. Doctors, and you would have seen it, the health minister is talking about doctors are going to get $8.5 billion with a B, a lot of Bs in this discussion, and it's going to be easier for you to go and see them and you won't have to pay anything. And the doctors are going, hang on a sec. Even doctors are feeling devalued. Like doctors with all that experience they've got, they can do so many amazing things for us, but they're feeling devalued. And what they essentially regret doing as a profession is signing up to Medicare, which actually set this false understanding about what you get and what you're paying for, because it hid the true cost of a service from the public. And so the public learnt to consume lots of it. In fact, our employers learnt to go, hey, just get a sick certificate from your doctor.
Yeah,
it doesn't cost me anything. Yeah. You can go and do that. They essentially outsourced a problem of theirs, which was they didn't trust their employees. You see the same in the cafe industry at the moment. People are saying, actually, Australians are going to have to get used to paying $8 to $9 for a coffee. That's the true cost. As a coffee drinker, I'm horrified by that, right? As a Melbourneite, I'm like, that's ridiculous. Like, we drink all this, you should be doing volume by now. But it's the same in our sector, right? We own our space. We have a clearly defined scope of practice when we're doing our professional role or playing that well, and we own the hell out of that. That's one thing 7 weeks in this sector has really told me, and it's really impressive to see. But we also devalue that. We need to remember a profession by definition, is a group that has a body of knowledge that is not commonly understood. Doesn't matter whether you're a plumber or a carpenter, a doctor or a nurse. Doesn't matter whether you're a lawyer or an accountant. So when you think about the body of knowledge that we have, we need to actually make sure we're protecting that. If your accountant said, I'll give you a free tax return this year, you kind of go, hey, that's really cool. But you'd also be going, do I want a free tax return? Really? You're sitting there going, will you get the base back, or are you just going to churn through this, right? So I think there's an interesting conversation our sector's going to have, because there's always the tactics to grab market share or increase trial and all that kind of thing. But what we also know is that as Australians, we're pretty good at a freebie, right? I believe in a republic, but we'll still get the Queen's birthday holiday, right? So, if you've met an Australian or you are an Australian, you kind of know the mindset already. And if you can grab something for free, you're gonna. That's why it works, right? But we also risk devaluing our profession. And when you think about that, you need to go back to the basics of, well, we should actually be really proud of what we bring to the table and not devalue it. Let's not accept that someone can go, I've got a uni degree, so you're Cert 3 or Cert 4. Actually, no. We own the hell out of that. We ran an AUSactive event a couple of months back. At Parliament House, we had a very senior member of the medical profession come and present to us. And we also had a presentation on GLP-1s. And one of our Cert 4 qualified PTs turned around and said to one of the highest qualified doctors in the country, do you know about this? And he kind of went, and essentially his response, well, we can't be across every research study. And she was like, hang on a sec, you GPs are prescribing this. You need to be across this. We're across this. We don't prescribe these drugs, but we're across it because we're seeing people coming in with osteopenia and with the muscle mass loss. You guys are prescribing a problem. We knew that because we own our space. So I think we need to be aware that we should protect that sense of we have a body of knowledge that isn't commonly known in the public, has a real benefit when we apply that body of knowledge to someone who's trying to achieve something in their health. And we should talk about health, not just fitness. Actually, what are your health goals here? Because not even doctors have the knowledge that we have. They learn anatomy, but actually the whole physiology and the movement stuff, they don't learn that. We have that kind of knowledge, but we probably play it down because it's our everyday. We've heard people go, Cert 4. And we need to be proud of that. We need to protect it and we need to value it. And at some stage, in all of the discounting for access to a resource that has machines and, sort of recovery areas and all that kind of thing, I think we probably drift netted our expertise into that cost cutting.
Got it.
And so I think we probably need to make sure we separate out that expertise, make sure that doesn't get dragged into, I guess, a race to the bottom on price.
And it will be race to the bottom, your viewpoint?
I think that's the risk. Right, we've got if I think about marketing terminology, we've got a crowded marketplace. It's saturated. We're opening up more. On a global level, Australia has more gyms per capita than most countries do, and we've got more variety. So there's constant choice. So people are going to be looking at what I think that one does versus what my last one did. They're going to be thinking about price. We know that once we start devaluing it, Aussies flock to it, right? It's a national trend.
Before we wrap up, a couple of questions. Are you a gym goer? And what's a gym goer? And when do you go to the gym? Morning, afternoon? What's your routine?
So one of the best things. So I do a number of things. I'm a middle-aged white man, so of course I'm in an indoor cricket team. I ride and I run, albeit I haven't been doing much of that lately. I walk my dog, and I've got this amazing place that I'm trying out because just coming out of COVID in Melbourne, I live in the inner north of Melbourne, and there is this beautiful new aquatic and leisure centre that opened up. And it's not often you have a brand new centre that's built by a council. They've got an amazing gym in there. They've actually integrated health in there. So they have maternal child health nurses there and allied health professionals who are in there. Amazing recovery area, 50-metre pool, and I love my swimming. And the great thing is I've got 3 kids. One of my daughters, who's a twin, actually goes to the gym while I do my laps, and then we catch up there, we sort of drive there, we sort of psych each other up for the workout that we're going to do. And we've actually just started doing a challenge where we cross over. So she's doing the pool and I'm doing the gym. It's great to have a new facility like that. She's also got another gym that she goes to, so that's the dad gym. Right. Obviously a leisure centre actually has a wide, they've got to actually cater to everyone in the community. So Darcy also goes to her younger person's gym as well.
Got it. My next question, if you opened up a gym tomorrow, what would it look like and what would it kind of be?
I've been on the Sunshine Coast today, and I actually went to Avanti.
Yeah.
Avanti is largely going for over 50s, and they've got, I think their oldest client is sort of somewhere in the mid 90s.
Yeah.
This place looks a lot different, and it's funny. I'm a bit of a bowerbird, so I pick ideas from all things. I would actually grab a gym. Could be Avanti. That was the thing that inspired this a lot. A gym, a general practice where you've got sort of allied health professionals and a GP and a nurse, and I put them on basically on the edge of an aged care facility.
Yeah.
And we try to reverse the trend in frailty.
Wow.
And we'd actually make it a health hub. And I reckon if you had that mix, you could do some really cool things in health. Because I was really inspired by, as they're taking me around their site, which has been there for a couple of years in Caloundra, I was inspired by just how they set things up. That age group doesn't seem to want to go into a gym, so it kind of feels more. It's not a resort, but it's got carpet. It's very bright. It kind of even the music they had going. They sort of it's definitely for the demographic. But you could see they had set up for a specific demographic who we know there's going to be 1 in 5 people in Australia over 65 by 2030, right? And they're looking at what they can do actively there, and they're really integrating the element of the care in with the going to a gym. But it didn't feel like any other gym I'd walked into. Not the flashiest fit out. Was using some great machines where they needed to, but was using stuff that you'd probably see in a gym 30 years ago where they had otherwise. So not a model that sort of needed wall to wall the latest stuff, as we know, like most fit outs do.
Yeah.
And I just thought, oh wow, I've got parents in aged care. If this was sitting on the edge of that, they'd probably be much more active and receiving more holistic care than just an aged care facility.
Wow, what a great hot tip there. That's amazing. And I think also too, to back that up, we have some clients that we market for the over 50s, and the cost per lead on Meta is just absolutely something I haven't seen in years.
Yeah.
So you're right on the money on that one.
Well, and look, when you look at it as, and I haven't touched on it, but it is a passion area, we know that we can reverse frailty. Not to, it's not about getting younger, but it's actually stopping the decline. We know that we can reduce falls. It's a big cost to the country. And 1 in 5 Australians are going to be over 65 by 2030. This is, the trends reports from IBIS are showing that it's coming up. Pilates is really big at the moment, and will probably be big for a long time. But you can't fight demographics, and demographics aren't a trend. Australia is going to top out at 32% of the population is going to be 65 in about 15 years' time. We can't ignore that group. And guess what? A lot of them, they're going to invest in their health. They don't want to be old like their parents were, and they want to spend money on that. They want to actually have proactive health, and they've got time during the day when your gyms are quiet at the moment.
Wow.
They are our ideal customers, and we've got a great product to market to them. We've got great impact we can have on their health, and we can literally transform the next 30 years of their lives.
And that's a great point you make too. My age bracket, my parents' age bracket, it's almost like they missed the constant message of health and fitness. There's so much more now. Getting my dad into health and fitness it's really hard, especially hasn't grown up that way.
Well, and look, I've got a good friend who's got a mum who retired down the coast in Victoria, and we're walking along one of the coastal walks because she was showing us the new place and how amazing the new place was. She was 60. Well, she was 68. Certainly when this story was, and this woman walked past the dog and she says, "Hi, Joy," and was like, "Oh, who's Joy?" And she said, "Oh, that's Joy from Calligraphy and Mahjong." And I was like, hang on a sec, it sounded like a complete Kath and Kim kind of moment, and it was. But actually, guess what? Joy's been doing new things because she's got the time to do new things, and she's got the cash to do new things. When you think about if you were to design your ideal customer, guess what? 1 in 5 Australians over 65, they're about as ideal as they get. It's a big market. They're everywhere. We've got a great product that's going to meet their needs. And all we need to do is meet them where they're at.
Amazing. Well, thank you, Ken, for the chat. We could talk all day, and it's really interesting because I think we hit a lot of nails in regards to what people can do to be ahead of the curve and what people can do to hit somebody's exact need at the moment.
Excellent. Well, great chatting. It's so good to be on here with you.
Thanks, Ken. Guys, that was another episode of the Marketing Muscle Up podcast show. You can watch this on YouTube or Spotify or iPhone, and we'll catch you next time on another episode. Bye for now.